We're going to be reading Facing Neurofibromatosis, a guide for teens. We'll be reading the first few parts of it. You may have just learned that you have neurofibromatosis, or perhaps you've been going to the doctors for years because of the disorder. You may only have minor signs, perhaps just some brown patches on your skin. Or you may have been living with more serious complications. Neurofibromatosis can affect the body in many ways, and it can affect different people in very different ways. In some, it may be nothing more than a nuisance, but in others, it can cause important medical problems. It is natural to have lots of questions when a person is told that he or she has a condition such as neurofibromatosis. How will this affect my health? Will it change my appearance? Why did it happen? What can be done about it? What should I tell my friends? Can I pass it on to my children? These are important questions. Anyone affected with neurofibromatosis should have the facts about the condition. This brochure has been written to explain what is known about neurofibromatosis and what can be done to help deal with it. What is neurofibromatosis? The term neurofibromatosis is put together from two words, neuro and fibroma. Neuro means nerve, and a fibroma is a swelling or bump consisting of a fibrous tissue. A neurofibroma is a swelling due to a growth of cells that surround nerves. Nerves are like wires carrying instructions from the brain to move muscles, to bring messages back from the body to convey sensation to the brain. Just like wires, a protective coating surrounds nerves. This coating is made up of cells, and is the excessive growth of some of these cells that cause the bumps on the skin or under the skin that are neurofibromas. Not all people with neurofibromatosis have neurofibromas that can easily be seen or felt. We will talk about the different ways that neurofibromas can appear later on. Neurofibromas are the most characteristic feature of the condition, so that's why the condition bears the name. There are actually two kinds of neurofibromatosis, called NF1 and NF2. Although they sound like similar conditions, they are in fact quite different. NF1 causes neurofibromas, brown patches on the skin, and a number of other features that will be described later. NF2 causes a different kind of swelling involving the nerve sheath called schwannoma. Schwannomas occur often around the nerve for hearing and balance, the acoustic nerve. So NF2 really doesn't cause neurofibromatosis at all, although it used to be thought that it did. NF1 and NF2 generally do not happen in the same person, or even in the same family, and NF1 does not turn into NF2. They are totally separate conditions. NF1 is far more common than NF2. Because it is more common, this brochure will be devoted to NF1. If you have NF2, a separate brochure is available with information about that condition. NF1, sometimes referred to as von Recklinghausen's neurofibromatosis, in honor of the German physician who accurately described the condition in 1882. It is also sometimes called peripheral NF, because it tends to affect the peripheral nervous system, nerves, more than the central nervous system, brain and spinal cord. How is neurofibromatosis diagnosed? There is no medical test available to definitely diagnose neurofibromatosis. The only way to tell that a person is affected is to examine them to see if there are signs of the disorder. There are several features that your doctor will look for, and it is generally agreed that anyone having at least two of the features listed on has NF1. Diagnostic features of neurofibromatosis: 6 or more café au lait spots, freckling under the arms or groin, 2 or more neurofibromas, Lisch nodules, tiny tan bumps on the iris of the eye, optic nerve tumor, optic glioma, characteristic bone abnormality, or family history of NF1. Café au lait spots are flat brown patches on the skin. The term café au lait comes from the French term for coffee with milk. Because this is similar to the color of these skin spots, they usually begin to appear during the first year of life and continue to increase in number for at least the first few years. It is not unusual for anyone to have 1 or 2 café au lait spots, but most persons with NF1 have a large number, generally more than 6. There is no connection, though, between the number of café au lait spots a person with NF1 and the severity of the condition, or between the lack of café au lait spot and the location of a neurofibroma. Café au lait spots may tan during the summer on exposure to sunlight and will fade in the winter. Too much exposure to sunlight is not good for anyone's skin, but the tanning of the café au lait spots will not cause any harm. In general, the café au lait spots are harmless and serve only as a clue that someone has NF1. They sometimes fade later in life, but we will talk about the ways of treating them if their appearance is a problem. Another characteristic is freckling under the arms or in the groin. Most people only get freckles in parts of the body exposed to sunlight, whereas those with NF1 get freckles in non-sun exposed areas as well. These freckles are harmless, but can make the diagnosis of neurofibromatosis. We have already talked about the neurofibroma, that it represents a growth of cells that make up the coverings surrounding nerves. Usually, neurofibromas are noticed as a small bump on the skin, often like a mosquito bite that doesn't go away. Sometimes there is little pinkish or purplish color over the site of a neurofibroma. Most skin neurofibromas are small, from pinpoint size to the size of a pencil eraser. They can occur anywhere on the skin, and can occur and appear at any time in life. There is no telling how many neurofibromas a person with NF1 will get. Some people just get 1 or 2, but others may get many more. We'll consider the cosmetic effects and what can be done about this a little later. Neurofibromas can occur not only on the skin, but also any place in the body where there are nerves. Sometimes neurofibromas can be felt as pea-sized or larger bumps under the skin. Others may be so deep in the body that you will not know that they are there. Skin neurofibromas are usually soft and painless. Those that are under the skin are firmer in consistency, but also usually painless. Sometimes, however, a neurofibroma puts pressure on a nerve. Symptoms will develop. These can include pain, numbness of a part of the body, or weakness. If you experience any of these problems, you should tell your doctor. One particular kind of neurofibroma deserves special mention. This is the plexiform neurofibroma. Plexiform neurofibromas represent growths around large nerves. They are thought to grow while a person is developing as an embryo, so they are usually present at birth. Sometimes they will be obviously early in life as an area of swelling, but other times they can be deep inside the body and harder to detect. When they are present near the surface, they sometimes grow to rather large size and cause deformities. Usually, if this is going to happen, it happens within the first 2 years of life. If these large neurofibromas are not present by adolescence, it is unlikely that they will ever appear. Lish nodules are tiny tan bumps on the iris of the eye found in most people with neurofibromatosis. They are totally harmless and never cause pain or problems with vision. They are hard to see without a special lens called a slit lamp, used by an eye doctor, ophthalmologist. This can be a very helpful diagnostic sign of neurofibromatosis. Another feature of neurofibromatosis that can affect the eye is optic glioma. Optic glioma is a growth that involves the cells for the optic nerve, the nerve that connects the eye to the brain. Most of the time, this does not do any harm, but in some cases, it can cause problems with vision or the production of hormones. Optic gliomas are usually diagnosed by doing a scan such as an MRI. This stands for magnetic resonance imaging, which takes a picture of the brain or parts of the body. Optic gliomas that cause problems usually do so in young children between 4 and 6 years old. It would be unusual for the problems to first appear much after this time. 2 problems with bone development can be characteristic of neurofibromatosis and help in making the diagnosis. 1. Curvature of the long bones, especially of the tibia shin bone, This is generally present at birth and will not appear later in life if it is not present at birth. When it occurs, it can cause weakening and even fracture of the bone. It will not occur out of the blue in a person with NF1 who does not have the problem at birth. The second bone abnormality of NF1 involves the bones that surround the eye, the orbit. Rarely these bones will be malformed, usually within neurofibromatosis growth behind the eye involving the upper eyelid. This can have major cosmetic effects, but fortunately, it is rare. Also, this problem would be present right from birth and will not develop all of a sudden in an older person with NF1. Final diagnostic criterion is the presence of NF1 in a parent, sibling, or child. As will be discussed later, NF1 is a hereditary condition, so its presence in a relative can be a clue to help make a diagnosis in a person who may only have a few signs. Anyone who has two of the features mentioned above is said to have NF1. One of the difficulties in diagnosis, however, the fact that some of these features are not only found in young children and only appear later in life. This applies particularly to fretboling, neurofibromas, and Lisch nodules. Often the first sign of NF1 is the appearance of cafe au lait spots, while other features only appear later on. That is why it is often necessary to examine a child year after year in order to confirm that he or she is really affected with neurofibromatosis. How does NF1 affect the body, and what can be done about it? Many of the effects of NF1 have already been mentioned: cafe au lait spots, neurofibromas. There is a long list of things that can happen as a result of NF1, but it is important to remember that no one gets them all, and most of the severe complications are fairly rare. We estimate that at least 2 out of 3 of those with NF1 have the disorder in a mild form. What's more, some of the more severe complications, like plexiform neurofibroma or optic glioma, would already be present by early childhood, if they are going to happen at all. A teen that does not have these complications has already escaped some of the more serious problems of the disorder. On the other hand, part of dealing with NF1 is realizing that no two people with the disorder, even in the same family, seem to be affected in the same way, and the condition is unpredictable. Cosmetic effects. Some people with NF1 have no change in appearance due to the disorder, but it is common to have at least some features that are visible on the skin. Cafe au lait spots be the most obvious skin change in most young people with NF1. Usually these do not increase in number after the first 5 years of life. Sometimes they can be covered with clothing, if present in such an obvious area with makeup. Actually, it is not that common to have cafe au lait spots on the face. It is possible to have cafe au lait spots removed by treatment with a special laser. It would not be practical to do so for every spot, but a particular cafe au lait spot that is especially bothersome could be removed by this method. Skin neurofibromas, when present, may cause more obvious cosmetic effects. A single neurofibroma can be removed by surgery, although there is no guarantee that the neurofibroma will not grow back. Usually, surgical removal of neurofibromas is reserved for a particular skin bump that is an obvious place and is unsightly, or is located at a spot where it causes discomfort. For example, rubbing against clothing. Some people with a large number of neurofibromas have chosen to have many removed at the same time, sometimes dozens or even hundreds. There have been claims of successful removal of neurofibromas using a special kind of laser. This is an expensive procedure, and it has not yet been shown to have lasting effect on improving appearance in people with neurofibromatosis. You should ask your doctor if you have questions about this method of treatment. The most severe cosmetic effects of neurofibromatosis result from the growth of plexiform neurofibromas around the eye or on the arms, legs, or trunk. As was mentioned earlier, this kind of neurofibroma problem occurs in very young children. So if a teenager does not already have a large plexiform neurofibroma, it is very unlikely that they will ever have one. On the other hand, if you do have one of these plexiform neurofibromas, you know they can be difficult to deal with. The only treatment available so far is surgery, and it is common to require many surgical procedures in order to remove some of the neurofibroma and try to improve appearance. Unfortunately, there is no way to completely remove a plexiform neurofibroma because its roots extend too deep. Therefore, they have a tendency to grow back after surgery. On the other hand, plexiform neurofibromas may grow for a while and then stop growing on their own. So far, there is no way to stop the growth of plexiform neurofibromas using medication, but this is a major area of research to be described later. Pain. Fortunately, neurofibromas are not usually painful. Sometimes a neurofibroma may become painful if it is bumped, and that pain can last several days in some cases. This pain generally goes away though. Neurofibromas located under the skin can cause a tingling or shock-like sensation if pushed on. Only rarely does the pain become severe, even enough to require treatment. Sometimes the best treatment is to remove the neurofibroma, but this is not always possible. If the neurofibroma cannot be safely removed, there are other methods of treatment available that can be very helpful. You should talk with your doctor about any neurofibromas that are painful, so that a careful examination can be done and appropriate treatment offered. Growth and development. Some people with NF1 find themselves to be a few inches shorter than others their age, than others in their family. This seems to be a common pattern of growth in NF1, and the reason for this is unknown. As long as growth is occurring at a consistent rate, there is nothing to worry about medically. Hormone treatments have been used to stimulate growth if it is occurring slowly, but that usually does not need to be done. Likewise, many with NF1 have slightly larger heads than other people. This may become apparent when they try to fit a hat or a helmet. Head size in NF1 has no relationship to intelligence. Puberty is a time of many body changes, and these usually occur normally in people with NF1. Occasionally, however, these changes will begin earlier or later than usual. Your doctor will be looking out for this, and may suggest some medical tests to find a reason for early or late stage puberty, if it occurs. This can usually be treated with hormonal therapy. You may have heard that puberty tends to bring out more neurofibromas. It is often the case that neurofibromas first appear during the teen years or may grow at that time. The cause for this is not known. However, it is important to realize that not everyone with NF1 experiences a change in their neurofibromas at this time. Learning disabilities. A large number of people with NF1 seem to have difficulty with learning. Learning disabilities are actually common in all people with or without NF1, but may be more common with those with NF1. Having a learning disability does not mean that the person is not intelligent. Learning disability means that a person has trouble with some particular aspect of learning new knowledge. This can take many forms. Some have trouble paying attention or remembering a sequence of instructions. Some have difficulty reading or doing math. The particular kind of learning disability varies from person to person with NF1 and also varies in severity. Only rarely is there a significant impairment of intelligence due to NF1. Also, it is important to realize that learning disabilities generally do not get worse over the course of time. It is very important to recognize learning disabilities and to take steps to deal with them as soon as possible. Unfortunately, some children with learning disabilities are misunderstood in school and taught that to have bad behavior or not to be working hard enough. Thought to have bad behavior or to not be working hard enough. Some teachers and parents may push to have the child work harder, not realizing that the child is working as hard as they can, but may be able to perform certain tasks in school as well as others. When special help is given, a learning disabled person can often do very well in school. Persons with NF1 can go to college and hold any kind of job. Fortunately, awareness about learning disabilities in general and associated with NF1 is increasing, and it is getting easier to arrange for special help for those who need it. Is neurofibromatosis a form of cancer? Neurofibromatosis is not a form of cancer, and neurofibromas are not cancerous tumors. Cancer is a disease which some cells of the body grow in an uncontrolled manner and then spread throughout the body. Neurofibromas tend to grow, but they do not grow like a malignant cancerous tumor, and they do not spread. You may have heard that neurofibromas sometimes can become malignant, or that other malignant tumors, like brain tumors, can occur in neurofibromatosis. It is true that this can happen, but fortunately, it is rare. The lifetime risk of a malignant growth related to the neurofibromatosis is about 5%, or 1 out of 20. This may seem like a high risk, but it must be remembered that about 25%, or 1 in 4 persons in the general population who do not have NF, will get a cancer sometime in their lives. Neurofibromatosis, therefore, adds only a little to the risk that all persons facing of development cancer. Skin neurofibromas almost never become malignant. It seems to be the plexiform neurofibromas that are at risk of becoming malignant. The signs of malignancy would be a sudden growth of a neurofibroma that was either not growing before or was only growing slowly, and then the appearance of unexplained pain in a neurofibroma. Pain that occurs in a neurofibroma after it is bumped is not worrisome, but if the pain appears for no apparent reason and does not go away, that should be checked out. Medical follow-up for NF1. You should expect to live a long life and enjoy good health in spite of having neurofibromatosis. NF1 can cause life-threatening problems, but fortunately these are rare. The majority of people who have NF1 go through life with relatively few medical problems related to the disorder and enjoy good general health. It is important to have regular medical follow-up in order to catch any complication of the disorder as early as possible. Generally, it is a good idea to see a doctor who is familiar with the disorder at least once a year, or more often if a particular problem is recognized. This doctor can be your family doctor, or maybe a specialist who deals specifically with neurofibromatosis. You should use these visits to ask any questions you might have about the condition, and call attention to any changes you have noticed in your body. It is especially important to ask about problems such as pain, growth, neurofibromas, or headaches. Usually, your doctor will be able to reassure you with simple physical examination. Sometimes, special tests will need to be done to check out any symptoms you may be experiencing. This is important in order to catch problems as early as possible. Is it necessary to limit activities due to neurofibromatosis? Just having neurofibromatosis does not mean that you should limit your normal activities in any way. People with neurofibromatosis are not especially fragile or prone to injury. Of course, if you have a particular complication of neurofibromatosis, such as a problem with a shin bone, a spine, this may require special protection and can interfere with some physical activities. You should ask your doctor if you are in doubt about this. Genetics of neurofibromatosis. Neurofibromatosis is caused by an abnormality in a gene. Genes are tiny structures inside our cells that control our growth and development. Genes determine traits such as hair color, how tall we are, our blood type. Most of our genes come in pairs. We inherit one from our mother and one from our father. This explains why we tend to have traits similar to our parents. A change in genes that prevents it from functioning properly may result in an altered trait or in a genetic condition. Neurofibromatosis is such a condition. It is inherited as a dominant trait, which means in an affected individual, only one gene of a particular pair has been changed. A person with a dominant condition like NF has a 50% chance of passing the abnormal gene to each of their children. Many people with NF wonder why they are the only ones in their family who seem to be affected if NF is a hereditary condition. Someone with NF can get the condition in one of two ways. First, they may have received NF gene from one of their parents, who also has the condition. Often, it is clear which parent has NF, and there may even be others affected further back in the family. Other times, a parent may be mildly affected and be unaware of having NF until a medical examination is done. Approximately 50% of children diagnosed with NF have received the gene from an affected parent. The other 50% get NF as a result of what is referred to as a new mutation. In these people, neither parent is affected, and the gene change resulting in NF occurred for the first time in the egg or sperm that produced the affected individual. Although parents often worry that they may have done something to cause the mutation, we know that this is not the case. Since passing on our genetic material is such a complicated process, it is not uncommon for changes to occur by chance and result in a condition like NF. Although a person who has inherited the NF gene from a parent is no different from one who has a mutation, it is important to determine how the change arose, since this may have implications for other people in the family. It is usually fairly easy to decide if a parent is affected by looking for signs of NF, such as neurofibromas, cafe au lait spots, and looking at the eyes for Lish nodules. If none are found, it is very unlikely that the parent has NF. This is important because it means that the risk to brothers and sisters of someone with NF is very low. It is important to remember, however, that regardless of whether a person received the NF gene from a parent or by a new mutation, they have a 50% risk of having a child with the same condition. It may seem a long way off, but it will be important to consider the genetic implications of having NF as you get to an age where you start to plan a family of your own. People with NF are usually able to have children in spite of this 50-50 risk that a child will inherit this disorder. Recent advances in understanding the genetics of NF made it possible in some instances to determine if the baby has inherited the NF gene. Unfortunately, though, there is no way to predict how severely a child might be affected. In some cases, mildly affected parents have children with severe complications of NF. When the time comes, it will be important for you to discuss with genetics of NF with your partner and speak to your doctor to learn the most up-to-date information about NF and what can be done about it. Dealing with neurofibromatosis. Adolescence can be a difficult time in life. It is a period when you are between being a child and an adult, growing both physically and mentally. It is also a time when you are trying to figure out who you are and what you believe. This can cause your feelings and emotions to intensify. You may feel confused, out of control, or think that nobody understands you. Having NF may add these emotions and can make an already stressful period seem even more so. NF can cause a number of physical changes to occur during adolescence. This can be difficult because it is a time when you usually become more aware of your body. Outwardly visible cafe au lait spots or neurofibromas may have already made you wrestle with being different from others. During puberty, neurofibromas may grow larger, become more visible, or increase in number. This may call attention to them, making others more aware that you have NF, and may intensify your feelings about NF. Being more self-conscious about your body can make changing during gym class or sleeping over at a friend's house feel particularly awkward. In addition, having NF can hasten or delay the onset of puberty in some cases. If this happens, you may feel uncomfortable about physically maturing before or after your peers. Adolescence is also a time of change in your relationship with your family. It is natural for teens to want more control over their lives and take more of their own decisions. But adolescence is also a time which changes in manifestations of NF can occur. Your parents are aware that you might develop more signs of NF during this time, and they are naturally watchful and concerned. This can intensify the tensions of adolescence as teens sometimes resent the scrutiny of their parents and want more independence. But this can also be a lonely and frightening time, feeling anxious about the changes that might occur. You need the support of your parents. It is important for parents and teens to make extra efforts to communicate with each other during this stressful time. Both parents and teens do well to remember that listening to one another is an essential part of communication. Slow down and let your parents speak, and ask them to hear what you need to see as well. Parents and teens can work together as a team to handle what comes during adolescence and manage NF. At times you may feel angry, out of control about having NF, since there is nothing you can do to prevent these changes from occurring. It is important to remember that other adolescents experience similar feelings for different reasons. More adolescents dread standing in the crowd or being different than anybody else. The truth is that no two people are exactly alike, and everybody has something that makes them different. NF may be just another difference for you. During adolescence, you may begin to be more involved in your own medical care. At the same time, doctor's visits will probably be difficult for you. You may not want to share information about your body or about changes that have occurred. You may think of it as an invasion of privacy. This is a common reaction for teens. Whether or not they have NF, it is important to realize, however, that seeing a doctor on a regular basis can help to keep an eye on changes that may need medical attention, as well as give you an opportunity to learn more about NF from your doctor. Having NF can sometimes make you feel alone and isolated. If you are the first person in your family to have NF, it can be especially hard. You may not understand how it occurred. Even if NF runs in your family, it may be difficult to talk with family members about it. You may wonder why you were chosen rather than a brother or sister, or you may feel uncomfortable if you have to go to a doctor more frequently. You may also not know any other people your age with NF. In any case, you may think that no one could possibly know how you feel or how it feels to have NF. You should remember that you are not alone in your experiences. There are many people of all ages with NF, and it may be helpful to contact your local NF chapter or your doctor about finding people with NF to talk to. Deciding to tell people that you have NF can be very difficult. Whether you have a few visible signs and no one knows you're affected, or if NF is more obvious, having NF is a very personal matter, and who you share this information with is your choice. You may want to tell your friends in order to bring you closer, yet even the closest friends may ask difficult questions. They make you feel vulnerable or treat you differently. They wonder about those things on your skin. They may not understand what a genetic disorder is and may be paranoid about catching NF. You shouldn't divulge information unless you feel comfortable in doing so. If you decide to share with them, you may be able to teach them something about the genetics and NF, and this may be able to help them understand your situation better. It is helpful to rehearse ahead of time responses that you might want to give so that you are not caught off guard with acquaintances that ask about cafe au lait spots or neurofibromas. For example, you might want to give a very brief answer such as, "It's like a birthmark," or "It's just like a little skin problem." With closer friends, you might choose to explain more about the genetic condition. There are some terms such as tumor that have unnecessary connotations, and you might want to choose not to use them in your explanations to peers. Telling your teachers about NF can be another hard decision. The most important reasons for them to know is if you have learning difficulties and need some special help. Another reason to tell your teachers you have NF is that help educate them and perhaps others in your school about NF and correct any misconceptions about the condition. At the same time, many people don't want to tell their teachers they have NF because they are doing fine and they are worried that they will be treated differently. Talking about this with your parents and discussing their concerns may help in making the decision that is best for you. As you gain more information, you may begin to think about the future implications of having NF, questions about NF limiting career choices, or causing medical complications may occur. You might also begin to consider the possible effects of NF on your decision to have children. Talking with your doctor and parents may help you address some of your concerns and relieve your anxieties. There is a considerable uncertainty with NF, and this can be overwhelming at times. Take it one step at a time, and do not worry about decisions too far in advance. As you move closer to adulthood, you will want to become well informed as you can about NF and your options. Local chapters of the National Neurofibromatosis Foundation may offer lectures, written information, a website, and support groups which can be very helpful. Many find that becoming more involved helps them to learn more and feel in control of their condition. It is important to remember that all people have some kind of adversity and deal with in their lives. NF is a challenge, but the process of accepting it as a part of yourself can make you a stronger and more understanding person. It is normal to feel angry and overwhelmed at times as you face the challenges of NF. However, when you take an active role in dealing with NF, as opposed to simply enduring it passively, you feel better about yourself and turn your adversity into some kind of positive growth experience. Taking more responsibility for medical care is one way that teens can deal with NF in a more active manner. Talking to others with the condition, joining an NF support group, or becoming involved in educating others or fundraising for NF research can give you a feeling of strength in the face of your difficulty and lessen your feelings of being different. It is also important to remember that NF may be one part of you, but it is only a small portion of who you are. Find activities in which you can excel. Feeling competent and getting positive feedback will increase your self-confidence and will help you put your NF into perspective. There's so much more that you can do than not do. You still have to go through the same things all of your friends do without NF. Feeling better about yourself and having a positive attitude will help you deal with having NF, as well as everyday problems. What kind of research is being done on neurofibromatosis? There is currently no way to prevent or reverse the complications of neurofibromatosis, and there is no diagnostic test for the condition. This is a time of great hope, though. The new methods of treatment will be developed through research. The genes responsible for NF1 and NF2 have been identified and are being studied by scientists all over the world. For the first time in more than 100 years since NF1 was carefully described, we have the tools necessary to understand what is really going on in this disorder. This has changed the way that we diagnose neurofibromatosis in some cases. The ultimate hope is that we will understand the normal role of neurofibromatosis gene and find out how to control its function. There's no way of knowing when or how this will result in a cure, but you can expect exciting progress to come faster and faster in the next few years. Conclusion. NF is a lifelong condition, and you must learn to live your life and not let the disorder rule your life. The more you understand, the more you will be in control. So be sure to ask questions of your patient, parents, teachers, and medical professionals. Find someone you trust and share your feelings, fears, frustrations, and challenges posed by having NF are hard, but they can be overcome. We gratefully acknowledge the assistance of Dr. Helen Hand, PhD, a clinical psychologist who contributed her expertise and insight into the writing of this guide. That was Neurofibromatosis, a guide for teens.